And on March the 18th, to protect you, we put in place our public health state of emergency. To date, we have 232 confirmed positive cases spanning across all health regions in Newfoundland and Labrador. And for the last 29 days, providing daily briefings and answering your questions. All of this with the intention to reach every single community in our province to ensure you have the most relevant information on how this virus is moving. To protect you, and on the advice of our Chief Medical Officer, we have put in place some aggressive guidelines to flatten the curve and slow the spread of COVID-19 throughout Newfoundland and Labrador. We also have a robust COVID-19 website created keeping you up to date. This is updated on a daily basis. At this time of the year, the evenings are getting longer and the signs of spring are popping up. As we head into the Easter weekend, this is the first big opportunity since Christmas where we usually gather at a church or around our supper table with family and friends. Now we have to accept that this year is very different. What has been normal throughout our lifetime has changed. To put it bluntly, your actions this weekend and beyond determines our future. What you do this weekend will make it or break it. Now, joining me this evening is Minister Haggie, a familiar face to us, and Dr. Fitzgerald, and Dr. Proton Rahman. At this time, I want to introduce Dr. Rahman as he's a new face to many of you. He's a clinician, scientist at the Eastern Health, and a professor of medicine at Memorial University. Now, we've asked the Newfoundland and Labrador Centre for Health Information to bring together a team. And we've asked them to consider various modeling scenarios to help inform our health system planning for the COVID-19 pandemic in our province. It's a fact some of you will require hospitalization. So this team will help us plan and prepare for your healthcare needs. The team includes experts from various areas, our regional health authorities, the Department of Health and Community Services, and Memorial University. Throughout this, they've had guidance provided by the Public Health Agency of Canada and engaged with others like the University of Toronto, the University of Oxford, and the Departments of Mathematics, Statistics, and Computer Sciences at Memorial University. Dr. Rahman leads the core analytics team, and he is here this evening to present this team's work. As you will soon see that Dr. Rahman's presentation, we cannot let up. Every single move you make this weekend and beyond will determine our future. It's your choice, and I implore you to make the right decision. Now, Dr. Rahman is an intelligent, a soft-spoken person, so I please ask you to pay attention as I hand it over to Dr. Rahman for his presentation.
So thank you, Premier Ball, for allowing our group to present. So I'm presenting on behalf of the work that was done in our group for the last 10 days or so. So the mandate of the Predictive Analytics Group is really to look at the trends in terms of the cases that we're actually seeing, determine what the clinical consequences are for our patients regarding having COVID-19 in the Newfoundland population, and then try to determine and forecast the capacity in terms of the healthcare system. And that's really important in terms of patients being admitted to hospital, ICUs, the need for ventilators. But it goes beyond that in terms of looking at what are the needs in terms of human resources, the needs in terms of personal protective equipment that, as you're aware, has become in such great demand. Also in terms of reagents for testing, for which, again, there's a big demand. But for today, what I'd really like to do is to focus the presentation on two different things. First is to look at the current situation. What is our current trajectory of COVID-19 and how it actually compares to the other provinces? How are we doing in terms of our ongoing public health measures that the Premier said were quite aggressive, but I'll show you why it's really appropriate and it's made a huge impact. And then subsequently discuss the characteristics of who is affected in Newfoundland and how are they doing. All important questions that you want to know. And then the second part of the presentation, we're going to look forward. And we're going to try to project in terms of what is going to happen to us. The issue of thinking forward is actually worthwhile, but there's a lot of caveats towards modeling. And we'll first discuss those important limitations and challenges in projecting cases. And then we're going to show you scenarios, short term, in terms of acute and critical care bed needs, and then as well 2 possible long-term scenarios. And possible long-term scenarios is what you have to remember. These are what-if scenarios and not necessarily married in that much science as of now. So what is the current situation in terms of COVID-19 in Newfoundland? So the first thing you have to always remember, as Dr. Fitzgerald announces the cases every day, is that we're, in terms of population, the second lowest in Canada. So you take the numbers and then you have to correct it for the population size. We're seeing a lot of graphs nowadays, and a lot of the things that we actually see are bell curves. The thing to remember about this particular graph is that it's the cumulative number. In other words, it doesn't actually come down, and the best response that you can have if there's no further growth is that the curve turns flat. So let's look at the trajectory of what's happened. So around the 3rd week of March, there was a rapid increase, almost like the COVID virus just sprinted out of the gate, and there was almost an exponential growth. This would have been very, very worrisome if this were to continue, and you can just look at the province of Quebec as a comparison in what happens when you actually reach that phase in terms of exponential growth. So this would have been catastrophic in terms of our healthcare system with very little warning to have so many cases. But something actually happened, and if you actually project forwards over the last week of March and May, the trajectory of the curve has changed altogether. And you have to ask yourself, what happened? What happened is public health measures. They identified that there was an issue in terms of the rapid progression in terms of the number of cases that we've had. Just through hard work, really an organized and a swift response team that actually did manual contact tracing. They were able to identify the case, test it appropriately, then subsequently either self-isolate or quarantine, depending on what your test result was. And then they did that in parallel with other measures, such as physical distancing, and as well in terms of non-essential work. And this has made the impact. This is what's really flattened the curve, and you can actually see it. And these are real numbers and not modeling. So everything that we're actually doing, as hard as it is, has made a huge impact. So now our curves are very much like Canadians. So much has been talked about with BC, and they've flattened their curves. It doesn't actually look that much different. They're still a little bit higher than BC, but overall very, very encouraging in terms of what it's been done. And the organized response has really helped avert a disaster. Let's look at our population a little bit quicker, and there is a story behind these curves. So if you actually look at just the trajectory for the total patients, it doesn't actually tell you what happened. One particular event, for all sorts of good reasons, but at the wrong timing, led to a rapid increase in terms of progression of the virus. And the trajectory in terms of cases from the funeral home, as you can see, it looks quite a bit different than what's in our community elsewhere. So when you actually see 2 curves going different way, it's going to be hard to some extent to model. But the more important issue and the story behind this is that it just takes one small indiscretion in a large setting to actually lose control in a small place in terms of what can happen for the virus spreading. So please, please, please follow the social distancing measures that are actually in place that Dr. Fitzgerald and Minister Haggie talk about. So now look at the health consequences of having COVID-19. So this is a novel coronavirus. Novel means that you haven't seen it before. No one's immune to it. So what that means is that anyone can get it. Those less than 5 have gotten it in Newfoundland. More than 90 have gotten it. But it actually spans all age distribution. Some can argue, well, the young individuals, most of them do well, 80 to 90%, which is excellent. But the issue about being well is that you still carry the virus, you still spread the virus. So everyone has to be responsible in terms of not trying to transmit the virus, whether you're that symptomatic or just mildly symptomatic. You still are a carrier, and it's really important to understand that particular principle. So the other thing to look at is who's actually getting sick. Sick defined by, if you have moderate to severe disease, you'll come into hospital. If you don't do as well, you get into the ICU. State after state, province after province, it's noted that people that are older, particularly those over the age of 70, don't do well. We don't see it in our data right now because we don't have as many individuals in that particular age group, but they should be particularly cautious. But the other message that we're seeing that's also seen throughout North America is that young individuals are ending up in the ICU. So here, for our ICU admissions, you can see that 18% of the individuals were in the age of 20 to 44. These are young people that think that they're healthy, and that's where they've ended up. So please respect the virus. It can make you quite short of breath and lead you to places that you don't really want to go. Is there any other predictors in terms of who is going to have a poor outcome? It's if you have coexisting medical conditions. I think about coronavirus. I think what actually brings you into hospital is you're breathless. If you have an underlying respiratory disease that your baseline is such that you're short of breath, whether it's asthma, COPD, heart failure, you're at risk. If you have underlying cardiovascular disease, ischemic heart disease, or if you have diabetes, you're also at risk. These are similar to what's been noted in other populations, but it's really important to think about for your own health. The thing that we have noticed is that people that are coming in to the ICU or coming into hospital have many more of these so-called comorbid illnesses or additional medical illnesses than those that are able to actually handle the virus well. So if you have 2 or 3 of these conditions, you have to be extra vigilant in terms of what you're doing. So essentially what we're trying to tell you is that we had a rapid increase in terms of our population. The public health measures made a huge impact and was really the only thing that actually changed the curve. There's no treatment for it right now, no vaccine, no medication. How did things happen that in a beneficial way? It was through the public health measures that were implemented. So now we're going to move into looking forward, not the data that we have, but what can we learn from the data and then project ahead. So modeling, as it's been talked about a fair bit in the press, is conceptually helpful. If you think about these what-if scenarios, it'll help you in terms of planning, help in terms of public health measures, in terms of healthcare utilization, and obviously has economic and societal ramifications as well. So it's helpful to think ahead, and some of the changes you want to make are not easy to implement, and it'll take some time as well. The issue with modeling, however, is that it's frequently wrong. It can be misleading, and that's because there's numerous underlying assumptions, even if the assumptions are grounded in the best evidence that we have. The issues regarding the coronavirus are evolving. Even if you stay abreast of what's actually established, there's still guesstimates at the best of times, and so the models are often misleading. That being said, it's worthwhile thinking about various scenarios that we'll present today. The unique challenges that we have in Newfoundland about the modeling is that 75% of our patients are from the funeral home cohort, and their dynamics in terms of viral transmission are actually does not actually follow the normal distribution. And as a result, clustering in Newfoundland is especially hard because of that variance of where the patients are coming from. Often clustering is done with a large number of patients, particularly deaths. So thankfully, we've had only 2 deaths, and obviously our heart goes out to the family members of the individuals that have passed away. But the lack of deaths also means that it's actually hard to project based on that particular parameter. There's also other technical issues where modeling is difficult. So what's our approach to look ahead? Our approach is a real pragmatic one. Let's get the data to drive the model, and let's think that this is a work in progress. What are we confident about? We're confident about short-term projections. So this is much more variability the further that you go. So we would like to tell the healthcare system what's happening next week, what's happening next month, And then let's just think about possible scenarios, but not really have certainty parameters beyond that. We want to look at consistency with the model that we have developed. So we're going to bring in a partner in the Canadian Institute of Health Information to see how their model fits with ours. And we're going to reach out to the universities, as Premier Ball said, the Stats, Math, Computer Science Department, to pandemic experts in University of Toronto, as well as to some individuals in Oxford, to look at their models to learn from them. One of the things we may actually have to do at some point in time is maybe build a model that actually looks and accounts for that cluster here in Newfoundland. But the most important thing we're going to do is to refine our model frequently, so that once we get enough data points and have a better idea of where we're going, we're going to rerun it again. So constantly keeping an eye on what's happening, and then subsequently revisiting the number of cases that we have and see if we can refine our model. With all those assumptions, let's show you a couple of graphs. So this, you often talk about in the press about the best and the worst case scenario. I'd really like to talk to you about the current case and then the worst case scenario. And so at the present time, if there is no social measures in place, the virus will do what it does. So that's something called the reproduction number of R0 of 2.3. So if we remove the measures right now, you can see that there'll be a slow exponential increase. This is by no means the peak, but at the end of April, we already have 200 individuals that are admitted to hospital. If, on the other hand, we follow current measures, and this is actually the implementation of these public health measures, has driven that reproduction number down from 2.3 to at least 1.5, you can see that the cases are much more manageable in terms of healthcare system, and we can take care of other things. So that's great. So if we continue to do what we're doing for this month, okay, we're actually doing well. In terms of if we don't follow things, we still have the capacity right now in terms of hospitalization beds, but it's only a matter of time before it catches up to us. So let's take the same model and look at it in terms of critical care beds. Why critical care beds? That's a real scarce resource because it gets saturated very, very quickly. And if you don't have access to critical care when you need it, then the case fatality, or the number of people that pass, increases very, very quickly. So when you need the ICU, you have to have a bed available for you. And so when you actually look at the ICU capacity with those same parameters, we'll actually run out at the end of this month, because our bed capacity in terms of what's the beds that we have available as of yesterday was 57. If, on the other hand, you're continuing with the social distancing measures and the things that have been put in place by the Ball government, you're actually fine. Okay? But I shudder to say that, and that's because things can change very, very quickly. We're already made aware that there is one individual in a long-term care home that has COVID-19. So why is that an issue? We all know that people that are in long-term care homes are older, have multiple illnesses, are in close quarters, and that's been a hotbed in terms of transmission. So it's not going to take very much to change the dynamics. So even though we're projecting, what we're saying is that this is a best case scenario for the present time, but things could evolve very, very quickly. And all of a sudden we sort of have to rethink and readjust in what we're actually doing. But at the present time, given the data, what's actually been done is working, because if you actually look at the projection, initially there, and this in green is the actual number of beds, it's actually starting to go down a little bit as compared to the projections, which is great. And so if the projections are overestimating, that's even better news. The next two slides are a little bit harder to explain. And this was done with a partnership with the Canadian Institute of Health Research. So they used a compartmental SEER model that assumed a mixed homogeneous population. It's pretty much the same thing we did. We looked at our 1 month result, and to the individual case, we actually matched perfectly. We looked at their hospital admissions, and the numbers were very close. So we're using a similar model to try to tackle this issue. But what they had was an outlook of what could potentially happen. So in the scenario from the Canadian Institute of Health Information, their assumption is assume that 1/3 of the Newfoundlanders over a 2-year period will get coronavirus. And this would be a reasonable number if we actually maintain our public health measures at the present time. So a third of Newfoundlanders were actually going to be exposed to the coronavirus. Okay. Given our total bed capacity, we'll actually be able to handle that in terms of our healthcare system. Given the number of present ventilators that we have, we barely make it, but we can potentially do it. But really, there's really no wiggle room there. But let's look at it in terms of our ICU capacity. This is just a model. We're not saying this is what's going to happen. It's projecting well beyond the time frame that you have much certainty about. But in this particular model, it's saying that at the end of June, you're going to reach capacity. Sometime in October or November, you may need 100 more ICU beds than are available right now. So our system has to adjust if that's the case. You know, we have to be much more prudent in terms of who's taking up these beds. We'll have to find the recovery rooms, operating rooms, in terms of increasing our capacity. But the most important thing we can actually do, if this were to be the case, is to actually double down on our public health measures and flatten the curve even more. The more you flatten that curve, the easier it is for our healthcare system to actually accommodate that change. Given the present model, and with all the caveats regarding the model, we're actually short in terms of ICU beds because it's over capacity. It reaches capacity around the end of June, early July. If, on the other hand, okay, you assume that 51% of Newfoundlanders have the COVID-19 virus, that's just catastrophic. It brings us so that the peak is a little bit earlier. A huge number of patients come into hospital. Our ICU is going to have difficulty coping, and we don't have enough ventilators. We're hoping we never get there, and the way to do it is to be really, really stringent in terms of self-discipline regarding the measures that they're promoting right now. So in summary, I purposefully did not put any slides in terms of numbers because it's not really about numbers, it's not about treatments. This is about non-pharmacological measures, in other words, public health measures, because this is what's clearly helped in terms of a significant impact in flattening the curve. So we need to continue this, but more importantly, we have to further improve our efforts to achieve the best possible outcome, because the future outcome for COVID-19 is highly dependent on the collective effect, the collective effect of our individual actions to stop its spread. Thank you.
Well, thank you, Dr. Rahman, and thank you for your projections and the work that you've put into your presentation tonight. It certainly paints a clear yet stark picture of why we must remain vigilant. What we do this weekend and beyond will make it or break it. Your actions this weekend and beyond will determine the turning point of this virus. We know that there is no certainty in predictions. The information we have is based on data, and that can, of course, change. But what is certain? That everyone is susceptible to the COVID-19 virus. And we know that everyone can transmit it. Now, we've had a few tough weeks in Newfoundland and Labrador. And you know, we had what is widely known as a cluster at a funeral home, where a lot of people got infected in a short amount of time. Thankfully, we were able to contain it by contact tracing. But in saying that, we lost 2 people in our province due to complications of COVID-19. We have 2 families that are grieving. 2 families that have lost a loved one. At this point in time, they can't even provide them with a wake or a proper funeral. They can't hug or console each other when they need it the most. That's devastating for these families. We don't want that for yours. The reality is, it could easily be you. You could be next. Your parents could be next. Your grandparents could be next. Or your child could be next. Now, when you talk about who was most susceptible to this deadly virus, it's people between the ages of 55 and 64. That's me. That's some of you. We are the ones who end up in ICU. And when you look at our population, well, that's where there's more of us than anyone else. Those are not the words that I want to share with you tonight, but these are the words that I have to share. As COVID-19 takes lives, it's only about your actions that we will save lives. It has no boundaries. Age doesn't matter. Gender doesn't matter. Postal codes, well, they don't matter. This virus isn't based in St. John's, it's not based on the Great Northern Peninsula, and it's not based in Gander or Labrador or even in my own community of Deer Lake. It's everywhere. You have to act as though the person in front of you has the virus, because they might. You're only one step away from this virus, a step away from bringing it into your community. You are not invincible. We have a lot of people in our province that want to put some positivity in people's lives. Well, I do too. I've heard stories of people wanting to go back to familiar church services or host outdoor movies, do parades to wish people a happy birthday or celebrate an anniversary. They're all great intentions. Your hearts are in the right place. But you can't. It's simply not safe right now. By doing that, you would be increasing the risk of spreading the virus. Now, we know what we're asking of you, day in and day out. It's difficult. That's the point we're at right now. We've put guidelines in place, and we're asking you to follow them. Only go once a week for essentials. Travel only when it's essential. The virus only moves when you move. That's its greatest strength, but it's also its greatest weakness. Just follow the rules. We still have a long way to go, and I know it's hard. But in order for any of us to have any sort of a future, we must remain vigilant and not let up. Together, let's take a hold of the virus and not let it take a hold of us. I will now turn it over to Dr. Fitzgerald for her comments.
Thank you, Premier. Good evening, and thank you for joining us today. Thank you, Dr. Rahman, for sharing this information with us this evening. And while it remains early in this disease's trajectory to make projections, your presentation helps us to put things in perspective. Early data indicates that our public health measures are having the intended effect. I want to thank everyone for your efforts. By staying in your bubble, physical distancing, washing your hands, and going out only when it's necessary, you are helping to curb the spread of COVID-19 in our province. While this information is encouraging, I need you all to understand that this is just the beginning and our work is not done. We must continue to abide by the public health measures that we have in place. We are in this for a long time yet, and as difficult as it has been, we must keep the pedal to the floor. As Dr. Rahman referenced, now is not the time to become complacent. It is time to double down. If we ease up on our efforts, 2 weeks from now will be a very different picture, and 2 months from now will be catastrophic. We still have the opportunity to reduce the spread of this virus in our province and keep our loved ones and ourselves safe. How well we adhere to these public health measures this Easter weekend will determine how COVID-19 will look in the coming weeks. We now know COVID-19 is contagious before a person is symptomatic. And we have always known that when we move, the virus moves with us. We have seen firsthand right here at home how quickly and easily this virus can spread. As hard as it is, this year calls for a different Easter tradition, one that keeps us safe in our protective bubble and our families and friends safe in theirs. The sacrifices we make this weekend will bring us all closer to a time when we can resume our lives and move forward, doing the things we enjoy with the ones we love most. Leaders of our faith communities are offering services online. For individuals and families who would have attended church this Easter weekend, you can now join in from the safety of your own home to embrace your faith and celebrate what Easter means to you and your loved ones. I know that what we are asking you to do is hard. I know that there are personal consequences for all of you. I also know that these measures are what will work to reduce the spread of COVID-19 in our province. These measures will help keep you and your loved ones safe. Today, for a change, I'll close with an update on cases in Newfoundland and Labrador. Since the media briefing yesterday, we have 4 new positive cases. These cases are within the Eastern Health and Central Health regions. The public health contact tracing is ongoing, and everyone considered close contacts will be advised to quarantine. The total number of cases in our province is now 232. By region, we have 219 cases in Eastern Health, 6 in Central Health, 1 in Western Health, and 6 in Labrador-Grenville Health. 53% of cases are female and 47% are male. By age, we have 20 people under the age of 20, 34 between 20 and 39, 33 between 40 and 49, 51 between 50 and 59, 50 between 60 and 69, and 44 who are over 70. 6 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 74 people have now recovered. We must make a continued collective effort to adhere to the rules of physical distancing, to stay home except for essentials, to wash our hands frequently and well, to stay home if you are feeling sick. We are at a pivotal point right now to reduce the spread of COVID-19. It is that simple. Thank you for your time this evening, and I hope you all take care and stay safe. Thanks.
Thank you, Dr. Fitzgerald. And I also want to take this opportunity to thank you for your own personal sacrifices and your unwavering support to the people in our province. I now turn it over to Dr. Haggie, and I also would want to comment and say that this minister is doing a remarkable job in leading our Department of Health and Community Services, and I also want to thank him at this point for his hard work. I now turn it over to him for a few comments.
Thank you very much, Premier. I think Dr. Rahman and his team are to be congratulated on what is really a made in Newfoundland and Labrador approach. I think there may have been expectations that we would come out with a slightly different approach here around models. What we've done is try to develop a forecast. I draw a weather analogy. Everybody in Newfoundland and Labrador looks at the weather over the course of the week, and we know how variable it is. But from my flying days, I can tell you that weather is really important in planning. You look at the weather and you get very accurate short-term forecasts through the aviation services, and you use that to make a plan, knowing that a plan is just that and may need to be adjusted, and you put in alternate destinations. And really what we've tried to do is to mirror that approach with a homegrown solution. Just as with the weather, with any level of forecasting, there's always uncertainty to predicting the future. It's easy to pick holes in any forecast or prediction. And as one statistician once said, all models are wrong, but some can be useful. And I think the information presented here today is useful from a variety of perspectives. As updated numbers come in, Dr. Rahman and his team will revise their projections and run the numbers again. And when those projections change, as they will, this group will be in a position to advise us and healthcare administrators as to how best to respond. Again, it's a guide, but it's a made in Newfoundland and Labrador guide. We've done that because we don't have the types of data and the types of numbers that you see in other territories and provinces. We have that one big localized cluster that we know has skewed our data. This approach, however, despite being unique to this province, is sound. It's been validated independently by CIHI, the Canadian Institutes of Health Information. It's an important tool that we're going to use today and in the future for planning and for preparation. But it's also an approach which can predict better what happens over shorter time periods, periods of 30 to 60 days. And we can use this at a very granular level to help the regional health authorities plan, to give them as much lead time as possible and practical to safeguard the system, yet allow for change as well. The individual health authorities will be provided with information that will be able to, which will enable them to see the impacts of what the projections are for them in their own locations, to enable them to see what capacity they have, and to enable them to see what capacity they need, and enable them also to see what they need to do differently. Dr. Rahman has referenced a potential shortfall, for example, even under the best case scenario for intensive care beds, and we're already having contingency plans as to how to address that. We may need to further refine the layout and the allocation of facilities and resources within hospitals. But as these slides indicate, these projections are based over a 2-year infection rate. This cannot be about waiting out this virus. It's about adapting to its existence and creating our own new normal. This is not going to go away anytime soon, and it's going to echo in some form or another through the rest of the year. How bad those echoes are will depend on how we behave. Now makes a difference. It's not a time for complacency. Slipping now will push us to the worst case scenario that Dr. Rahman and his team have presented, with more Newfoundlanders and Labradorians being exposed to and getting the virus over this next 2-year period. These figures also show that people 55 to 64 are those much more likely to risk hospitalization and much more likely to end up in intensive care units. Those with 2 conditions or more do less well. Diabetes and high blood pressure are mentioned on those slides, and we know that we have those conditions in large numbers in this province. They're common, unfortunately. Our greatest challenge, therefore, is to prevent the spread of the virus. The better case scenario, which is still going to be a challenge, based on what we do now and what we've been able to do, relies on us continuing at least to do that and ideally to improve on it. And certainly the discussions that are going on in our department at the moment and across government are what other advice from public health officials is there for things that we can do in addition to those that we are currently doing. But the other scenario, where 50% or more of Newfoundlanders and Labradorians acquire this virus over 2 years, shows us very clearly the awful prospect. If we slip now in any way, we will simply not be able to cope without drastic changes, and even then, it is unlikely we will be successful. So what we do this holiday weekend matters. We need to take a break from family holidays. We need to take a break from going to the cabin, because your next cabin party will be our next calls, and we will not have the capacity to deal with that over the longer term. Unless you are an essential worker, the only reason to be on the road this weekend should be for your own immediate health needs. Anything else is rash, and frankly, it endangers every one of us, not just you. The virus only moves if we move. Stay safe, keep us all safe by staying home this weekend. Thank you, Premier.
Thank you, Minister Haggie, and thank you once again, Dr. Fitzgerald. In conclusion tonight, I also want to thank Dr. Rahman for his projections and his regular updates, which he's committed to provide to Newfoundlanders and Labradorians, and the great support that he has to our team. So if there is one message that I want you to take away tonight, it's this. This is not a test of our system. It's a test of you. The system fails only if you fail. What we do this weekend and beyond will make it or break it. Your actions will determine if the virus grows or it dies. So don't let up. Keep your distance and stay safe. We wish you a happy Easter weekend. For those of you who will not see us tomorrow, but For those of you who will be tuning in, it will be a regular briefing at 2 p.m. tomorrow. I thank you.